The Chicago manipulation, or the Chicago high velocity thrust, is the defined adjustment maneuver. It is used against several different types of dysfunctions today. First, it is used against what is called anteriorly rotated ilium. It is used against posteriorly rotated positions, that is as described above, right over left, left over right. And then it is used against posterior unilateral nutations, and it is clearly located on the right-hand side. If we are going to attempt to perform a high-velocity thrust here on the patient's left leg, I carry it out by lifting that leg straight up here, right to this level, so that there will be no adduction or abduction. The patient lies completely still and neutral on the examination table. I lift the leg up, the other leg is placed, the second leg is then pushed in underneath the first, and finally the leg is lowered. When you perform this maneuver, the fact that he has placed this leg under or over the other becomes clearly evident indeed. In practical terms, that means that he now has a small posterior rotation of his own ilium. Thereafter, I gently pull the patient's pelvis toward me so that his foot here is extended farther out than his hip. If there is anyone who, so to speak, has a particularly large pelvis, or if you happen not to be especially large in stature as a therapist, then it can admittedly be a sensible idea to stand and rock gently back and forth from side to side, and at some point you simply perform a scoop. That certainly makes things easier because then you have a smaller, more convenient support point to lie on. Thereafter, the patient should interlock their fingers and place them behind the neck area, which implies that we must remove our loaner cushion, which we position here below. Next up is exactly what we still need to do today, and there are several different ways to go about this here. Some people place their hand beneath the elbow and lift it up with the hand. This is very burdensome and exhausting for the therapist, and the patient requires that they maintain a lot of contact with the hand, so I won't demonstrate that one because I personally actually don't like it very much. However, in this position, we ask the patient to perform a front-of-the-body exercise or an abdominal exercise progression. But not everyone can do that, so we help by holding at the shoulders. When they come up and the shoulder blade is free, I perform a torsion. That means I twist the body on its own axis so that they lie on the shoulder blade that lies opposite me. Be careful not to side bend to either side. Okay, that is a pure torsion. So I go down here right now and hold like this, and then I say to him directly, try to perform a force exercise and abdominal exercises as well, and then I apply a torsion right away. In this position, he basically just lies resting now on his shoulder blade. I provide support to him and assist him by wrapping my arms broadly around his entire shoulder blade and by positioning my forearm around the GH joint. After that, we can observe that the more rotation I perform now, at some point his own SIAAS rises up. And I would certainly like to prevent that because I would very much like to have the ilium back. And keep in mind that when you push the ilium back, it's the same as bringing the sacrum forward, and therefore you can use this technique against several kinds of dysfunctions, either when the sacrum is back or when the ilium is forward in any case. What I do is to hold a wide, secure grip around the sciatus, down here. Be careful not to press too hard, so loosen this grip a little here and keep the contact gentle. And then I turn him until I can feel a tension building down here. The next thing to remember is how the direction of the SI joint lies. It actually lies a little obliquely toward me. And to get the correct direction for the manipulation, you do this. In order to obtain the proper directional alignment, you move the elbow outward, that is, away from yourself, and ensure that your neck, so to speak, lies almost directly down over the SI line for alignment. People talk about how if one could imagine wearing a necktie, the tie would touch the SI joint in the lower back area. So that means I hold here, step out a little, and move my elbow away from my body. The tie hangs straight down under the joint here, and then I apply a pressure described as 3/4 inward and 30 around. Okay, this is what it looks like when you see it. He may freely take a deep breath. Whenever he takes a deep breath, he lets the breath out slowly. That is to say, he would like to rotate back. Is he allowed to do so? And every single time he exhales, I spin him around more. This is what it looks like. Take a deep breath in and exhale and then relax. Again, take a deep breath in, exhale, and relax. Extend your elbow out, and then the pressure comes. Push down there, rotate there. This is exactly how you do it. It is only when the joint is under fairly strong compression, and especially near an anteriorly rotated ilium, that you get a manipulation spike here indeed, because there really isn't any fluid at the top of the SI joint. And since it is the fluid, the thing that liberates these oxygen particles that cause you to get this manipulation spike, you should not really expect it to say anything at all. But it's not the same as saying that one has not manipulated. Remember that.